Alrighty. Hi, everyone. Thanks for coming in, logging in with us today. I'm going to ask once you're in, if you could please mute yourselves as to not disrupt the presentation here. My name is Amanda McDonald. I'm the events chair for CDS East Bay, and also Vicki is here. She's our president. Vicki, give your hand. And again, thank you guys for joining us tonight for our Starwood First Aid Clinic with Dr. Kara Wright and Dr. Bridget McCarthy. Okay, so tonight we're going to go over an important course that will provide new insights on how to handle emergencies, as well as a refresher course on practices you may already be familiar with. We're also going to talk about snake bites and answer some questions that you guys emailed to us beforehand. So now I'll let Dr. Bridget and Kira take over. Thanks so much.
All right. Let me get this going. Oh, hold on one second. Hi, everybody. Nice to see you. It's nice to see some familiar faces and names on the screen. Hi, girls. Hi, Lucy. So yeah, give me 1 second. I'm going to figure out how to share my screen, and then we're going to roll through this. If you all come up with questions, you can throw them in the chat box, and maybe Amanda or Vicki can keep an eye on the chat box and let us know, because when I have my screen shared, I can't see. So Bridget, maybe you can also just make sure that works out. So y'all will have to tell me if you can see this.
Yeah, we can see it.
Okay, great. Cool. So as Amanda said, I'm Dr. Kara Wright, and this is Dr. Bridget McCarthy, and we are 2 of the 6 veterinarians at Starwood Equine. This picture with the 5 of us is a little outdated. We had Dr. Sophie Russell join us in October. She was another vet out in the East Bay who decided to come to the maroon side of things. So anyway, yeah, we're a 6-doctor practice with half of us in the East Bay and half of us in Woodside. We see appointments all over, all sorts of stuff, sports medicine, regular care, emergencies, all that good stuff. So if you have any questions, our contact info is here, and it will be, again, provided at the end. So if you come up with a question later, feel free to shoot us an email. And then just a little bit about us, for those of you that we don't know. My name is Kara Wright. I'm from the East Coast. I grew up outside of Washington, D.C. I went to school, I did a master's in equine reproduction at LSU down in Baton Rouge, and then I went to vet school at Virginia Tech. And then after that, I went straight to Ocala, where I stayed in Florida for a few years. And then I had this awesome chance to go live overseas. So then I traveled for a while and worked in the States back and forth, as well as in Australia. And then I came back, and here I am in the East Bay enjoying 60-degree days in January, which is awesome. So that's me.
And I'm Bridget McCarthy. I grew up in Southern California and actually went to school in the Bay Area. And that's where I met Dr. Kelly Zaytunian, who started Starwood while I was at Stanford working on the equestrian team. And then I actually got in touch with her when I was trying to decide what to do after graduation. Do I stay in autism research, or do I kind of pick a different career path? Decided to get into veterinary medicine, and actually worked at Starwood Equine right when Dr. Kelly Zaytunian started the practice for 2 years prior to heading to vet school at Davis, and then was fortunate enough to come back to Starwood as soon as I graduated. So happy to be back in the Bay Area.
Cool. So again, thank you all for joining us. We are going to go over a normal physical exam. There's no way to know what is abnormal with your horse unless you know what is actually their normal. And then we're going to go through a few types of the most common things we see on emergency, and then what you as a horse owner or a barn manager or whoever need to do when you come across these situations. And then again, we did get a few questions ahead of time, so I tried to throw the answers to those in here. But again, if you come up with a question, throw it in the chat box and we'll make sure we get to it. Okay.
All right, so let's go over a little bit of the normal physical exam for a horse. We're going to talk about some things that you might want to have in your first aid supply. It also might be helpful for you to have a thermometer and maybe even a stethoscope, just so that you can start getting these vital parameters. Learn how to take them, feel comfortable doing it. Just as Dr. Wright said, you need to know what's normal to know what is abnormal. So here's just the normal vital parameters in a horse listed right here, 99.5 to 101.5 for temperature. Heart rate, you see 20, I'd say 24 to 44, depending on how relaxed the horse is. And then respiratory rate, usually around 12 to 16 breaths per minute. We'll talk about a few of these other aspects of, how we get those respiratory rates, mucous membranes, and look at their attitude. And then, of course, we want to pay attention to their GI tract as well. As we know, horses tend to have some issues with their GI tract. So if we go to the next slide, we can kind of draw it all together. And I think you guys got access to this prior to the presentation, which is great. But these are kind of just all the different areas that we're looking at when we are doing a physical exam on a horse and every horse that we see on a daily basis. So if we start with the heart rate, one important thing for that, we said 24 to 40 beats per minute. That's pretty slow and much slower than the human. So you got to think of, the heart sounds as lub, dub. That's 1 beat, not 2. So some people will call us and say, oh, they got a heart rate on this horse and it's 110. And, it's not actually that high. You just have to actually count lub, dub, and that's 1, not 2 beats. So that is where you would listen to that. If you were to put a stethoscope on the horse, you really shove it up behind their elbow, right at this little arrow where it says pulse, press really hard, and you can get used to listening to that with a stethoscope. Respiration, 12 to 24 breaths per minute. A lot of people will kind of, put their hands up to the horse's nose to say, is this, and try to get a sense of their respiration from there. Really important to kind of just watch their abdomen actually and going in and out so that whether you're going, they're not sniffing your hand and really increased respiratory rate, and instead just looking at when their abdomen goes out and in. And again, it's pretty slow. So that's another important one that we like to take, pay attention to. Also temperature. I think an important one for this too is just keep in mind the outdoor temperature too, and also blanketing on your horses. So, if it's a really, really chilly morning and they don't have a blanket on and you're getting a temperature of like 101, yes, that is within normal range, but it's also really cold outside. So that might actually be more elevated. So kind of just take into account, and also on the other, the other end of the spectrum, if it's 110 outside, that might influence the horse's temperature as well. Important when you're taking a temperature of a horse to really kind of press that thermometer against the side of their rectum, and so that you're really getting an accurate temperature, and stay there until the thermometer reads the full 10 seconds. So you're really seeing what it is.
I do recommend y'all to get one of the 10-second digital thermometers, so you're not standing back there for a really long time. So
yes,
those quick
some of them can take
Walgreens, that's all you need.
30, 60 seconds, and you don't want to be back there for that long. Let's see some other ones that we go through. We actually, you may notice when we do our physical exams, we listen to gut sounds in 4 quadrants on the horse, so 2 in each side. So we're really listening up high on that abdomen, and also down low on both sides, to make sure that there are present gut sounds. And it really is kind of like a gurgling sound that you hear, sometimes a little bit of a flushing too, and you just want to make sure they're present in all sides. Digital pulses is one that we will be talking about during the rest of the presentation too. And that is basically getting, putting your hand, is kind of hard to do it, over Zoom, but really putting your hand on either side of the fetlock. You can feel a little bit of a bouncy structure that is a vessel, getting a sense of, can you actually feel that pulse? And once you get used to what a normal pulse will feel like, if it's increased, it's kind of bounding. And that means there's more blood flow going to the feet, so that there could be some source of discomfort in the feet. So another thing to practice, and maybe hopefully we can have, a hands-on wet lab at some point in the future, where we could practice some of these things. I think that's all I got for the physical exam. But we next have, I know this was one question of a first aid kit and what you should have in your first aid kit. We'll be sure to get this list to you guys as well, but we just kind of listed different bandaging supplies, and then of course scissors, gloves. It's always helpful to have some butanbanamine, some nonsteroidal anti-inflammatories on board, but we always recommend calling before administering, because sometimes we like to know, what is the actual pain level of the horse? Are they running a fever before we give them those medications? I think that is it for that.
Yeah, so we'll make sure we get you that list of a first aid kit, but let's move on and talk about colic, because this is one of obviously the most common things that we see as veterinarians, and probably one of the scariest things that you as horse owners um, can come across. So essentially, colic is a super broad term that just means abdominal pain. So a horse can act colicky and painful, and it doesn't actually mean that they have a stomach problem or intestinal problem. Mares can have ovarian issues that can cause what seems to be abdominal pain. There can be kidney problems. So there's a whole lot of things that can go on. But in general, a colic most of the time is a GI tract issue. The equine GI tract is huge, right? It's like so much stuck into their little abdomens that it's really crazy that things don't go wrong more often. But if you look at this very much not to scale diagram, you will notice there's a few places where there's some sharp 90-degree turns. And those are really common places for horses to get what we call an impaction, where some feed material is maybe a little dry because the horse is a little dehydrated, and then it doesn't really make the turn because it's a little too hard, and then things start getting backed up and the horse starts getting gassy and the horse starts getting painful, and it's this whole cycle. So if you imagine 100 feet of all of these squiggles, there's a lot of places that things can happen. Like we said, tons of reasons for colic. We can start at the stomach. I think everyone here has probably heard of gastric ulcers. That is something that we see fairly often as a cause of low-grade recurrent colic. Horses can also get gastric impactions where their stomach is not emptying and they've got feed material stuck in it. Small intestine, which is the really squiggly bit that we saw on that last slide, there's a lot of things that can go wrong. It can get an infection, it can get obstructed or twisted. The large colon, the large intestine, there's a lot of things there as well. I would say the most common thing that we see is usually just what we would call a mild spasmodic colic, which is just kind of a gassy, crampy situation. And then sometimes there are situations in which they get an impaction in the large colon, which is one where they need a lot of hydration. And sometimes it takes some work to get that hard feed material to move all the way through their GI tract. And then the cecum, which if we go back to the slide, which, sorry, it has the individual button pressing. The cecum is it's much bigger in real life, but that little sac down at the bottom right of the diagram, and that is where they ferment and where they break down a lot of the starches that we feed them. And a lot of times the cecum can do some really weird things. So that's a place that that stuff can happen in a horse. So the point of colic is not a colic is not a colic. There's a lot of different things that can go wrong, and figuring out exactly what it is usually pretty important. I think most of us are probably familiar with things that would indicate a horse is uncomfortable and they might be colicking. So they're pawing, acting uncomfortable, they're looking at their belly, they're kicking at their belly. In more serious cases, they may be down on the ground and rolling back and forth and sweating. But I would say, especially here where we pay a lot of attention to our horses and we see them or somebody sees them, they're usually getting looked at several times a day. The first thing people may notice is that the horse is not finishing their food. So oftentimes that's the first sign of colic in a horse, is that they just don't finish their breakfast as fast as they usually do. So knowing what your horse's normal behavior is really important. So what do? You think your horse is colicking. Obviously, again, the first thing I would like you to do would be to call us and say, hey, Dr. Wright, I think this is going on, so we can at least chat with you about it and see what's happening. It doesn't mean I need to see it, but I would just love to know that it's happening. So first thing, I would actually change the order of this. The first thing I would do is, if you think your horse is colicking, is pull out all the hay, grain, and don't feed it treats. If there's something a little bit more serious going on, we don't want to keep putting food into the intestinal tract. Next thing is get a heart rate and a temperature if you can safely. So if the horse is extremely painful and is rolling on the ground, don't try and do that. Make sure you stay safe and stay out of the way and give us a call. Sometimes when you call, we will say, okay, let's go ahead. Do you have a dose of Banamine? Let's give it. Sometimes when a horse has a very mild colic, the only thing they need is a tiny bit of pain relief to kind of stop the cycle of cramping, and then they will feel better in a few hours. But again, this is something we would really love to know before you do it, just because it's an important piece of information for us if the horse continues to colic. I know a lot of people want to take the horse on a walk, which is sometimes is fine if the horse is, on the ground and rolling and you need to walk them to keep them from hurting themselves. That sounds great. But I've also been to colics where people have like walked the horse for 4 hours until they can barely stand up and they're sweating and they're exhausted. And then the horse is in worse shape than they were before they started colicking. So use your judgment. I will say, hopefully, knock on wood, this will never be the situation. But if the horse is so painful and you are nervous that they are going to hurt themselves or someone else, put them in a round pen or in an arena and just leave them until the vet gets there. So do not try and keep them off the ground yourself. Do not try, don't try and do anything heroic. Just be careful if a horse is that painful. Logistically, I would love for everybody to have a plan, a budget, and their insurance information handy before you need it in an emergency. And this doesn't just go for colic. This goes for anything, with your horses, probably with your cars. This is like good life advice, like have a plan and know what you want to do. One of the toughest things for us as veterinarians is when we have a case that may need further care or diagnostics and the client is so just upset and shocked and they can't make a decision about how they want to proceed with the horse. So this is something to think about, and that's something we'd be happy to talk to you about, like, what does that mean? But, sometimes a horse needs to go to the hospital, and maybe not for surgery or something scary, but sometimes they need to go for fluids and monitoring or further diagnostics. And it would be great to know if that's something that you want to do, or if that's something you're never going to do. That is really helpful for us. So you call us and we're like, okay, great. We're going to come take a look. Let's see what's happening. So we're going to do a quick general exam, just like Dr. McCarthy said, heart rate, gut sounds, mucous membranes. Is the horse hydrated? What's going on? Do they sound super gassy? Do we hear no gut sounds? There's a nice medium where they should be. Most of the time we will do a rectal exam, which involves us trying to feel as much of the abdominal cavity as possible. And obviously we are people and they are horses, so we cannot feel the whole thing. Our arms are not that big, but we can oftentimes feel abnormalities as they are coming. And that can be a really nice indicator of what kind of colic is happening. Or sometimes we'll feel something, and even if the horse is looking like they're doing okay, we may feel something and say, you know what, this feels like a displacement. I think this horse needs to go to the university because this has a chance to take a turn to be a little more dramatic. So we'll usually do a rectal exam. Passing a nasogastric tube is something that we often will do as well. And that involves passing a tube from their nose into their stomach. And in doing that, we are assessing what is in their stomach. Do they have fluid buildup? What's happening down there? And also, more importantly, we usually will hydrate them with a bunch of water and maybe some electrolytes. A lot of times horses will have an impaction or some dried feed material way, way deep in their GI tract, and oral fluids are the most effective way to get that softened up and moving. Two of the other procedures that we sometimes do on colics are an abdominocentesis, which is also known as a belly tap, or sometimes we will do a full abdominal ultrasound. I will be honest that I usually do not do these on the farm anymore. If a horse needs those things done, I prefer them to be in a hospital where then they can fix the thing that they are going to find. If I'm doing them on the farm, I'm going to see something and then say, okay, it needs to go to the hospital. So sometimes it is just easier to get it all done in the same place and not waste time on the farm doing something that then they often will repeat at the hospital and then cost you more money. Medications. So Dr. McCarthy already mentioned sometimes we'll have you give buterbanamine. Those are, the first thing we do is give a little bit of pain control. Sometimes we'll give sedation with some other pain control as well. There's another medication we're going to use often that is an antispasmodic that will stop those gassy colics. That works really nicely. Like I said, the other thing we're going to do is our job on the farm is to decide if this horse can stay on the farm and get treated and be comfortable, or if this horse needs to go to a hospital setting. And I just want to make sure everyone is clear that if we send a horse to a hospital, it does not always mean they are going to have colic surgery. What it means is that they need to be in a place where someone can keep an eye on them, or where they can do just a further level of diagnostics and constant treatment that we can't do in the field. like, for example, a horse that needs fluids, they need 20 liters of fluids just for their first dose of fluids. I promise that nobody on this talk wants to pay me for my time to stand there watching fluids drip into the horse. It is one of those things that is much more efficient to get taken care of in a hospital. They can also make changes much more quickly than we can on the farm. So again, if the vet tells you that they think it needs to go to the hospital, it doesn't mean it's bad and horrible. It just means it needs a little bit more care than we can do a nice job of on the farm. And then going into colic surgery, which obviously sounds really scary, and it is. I mean, it's a big abdominal surgery. It's a big deal. However, it's usually pretty darn successful. Obviously, that depends on the problem, but in the 2014 study that I have here, over 80% survive the surgery. And then of those, 75% leave the hospital. So a lot of horses do just fine with a surgery and the aftercare. And it does take a while and it is stressful, but most horses do really well depending on the problem. Another thing I do want to throw out there is that age is not a factor in whether a colic surgery is going to be successful. Horses up until their late 20s and early 30s have similar survival numbers as their younger friends. So please keep that in mind if colic surgery is in the realm of treatment that you plan on giving for your horse, is that if a horse gets to the hospital in time and goes to surgery, the success rate is really good. The times that I see it not working when I was working in a hospital are when I would get a horse in that had been colicking on the farm for 2, 3, 4 days, and then they finally sent it because it wasn't getting better. Those horses had a lower level of success just because of the time in between first diagnosis of colic and actually getting to a hospital. Also, sorry, I talk really fast. I'm under caffeinated, so I don't know why I'm talking so quickly today. Here's just a couple of pictures. On the left, the big picture is a couple of our peers doing a belly tap, and then on the bottom right is a picture of them doing an abdominal ultrasound. In that picture specifically, they're looking to see if they can see the kidney, which is, there's this one weird kind of colic where the colon flips over and blocks the kidney from view on an ultrasound. It gets in the wrong spot. After a colic, again, obviously it depends on what's going on, but refeeding is important. So we will usually tell you to withhold hay, and we'll usually do some mashes for a few days and then slowly build them back up into their normal routine. Obviously, a horse that has had a colic surgery is going to be a totally different ballgame. Prevention of colic is obviously a thing that everybody wants to know how to do. The key is don't make big changes to feed and routine. Do them slowly. Always feed horses plenty of forage. That goes for ulcers and colon colics. Horses are meant to be grazers and they're meant to eat hay and grass. So the ones that get fed a lot of forage are going to generally do better. And then hydration. Make sure the water's clean. Make sure they've got a couple of things to drink out of. If you get a new horse, give it a bucket and the automatic waterer, because sometimes they don't like one or the other and they won't drink and you won't know. Obviously, thank goodness we don't have to worry about it freezing here, but a little bit further north, that can be a huge problem, is when ice buckets freeze and horses can't get to their water. And then on the opposite season, when it's super hot and horses are sweating all the time, add some electrolytes to their daily ration, and that will help encourage them to drink as much water as they need. This horse is happy because she colicked and now she's passing manure. I do want to say, just because a horse is passing manure doesn't mean they're not colicking. They can have different sorts of things going on where they will still be pooping, but they still have a problem. So whether they are or aren't is good information, but it doesn't tell us exactly what's going on. So in these photos, these are post-colic surgery photos. So this, the big picture with the band is a belly band, which gives support to the abdominal incision, and then on the top right, you can see we're looking at the underside of the horse, and that ridge has a ton of staples in it. And that is where they actually open the abdomen and perform the surgery. And then on the picture on the bottom, that they're covering the incision with a blue towel. Dr. McCarthy, is there a question in the chat?
Yes, I was just going to mention that. We have a question that is, what is the purpose of the belly tap?
That's a great question. The belly tap is used to characterize the abdominal fluid that is free floating in the abdomen. So our abdomen, horses' abdomens, your dog's abdomens, there's all this fluid. Actually, that's not true. Not all this. There is some fluid. But doing an abdominal tap, you can decide, is there too much fluid? Does it have infectious cells in it? Does it have blood in it? Is it unhealthy? There's a couple of other things we look at to characterize the status of perfusion in the horse that we use it for. So the ab tap is something, when I worked in a hospital, I used it a lot to determine how quickly the horse needed to get on the table for surgery. Whereas in the field, I tend to use other things to decide if the horse needs to go to a hospital, and I don't jump straight to an ab tap. So hopefully that answers your question.
And let's see, we have another question. Where do you refer surgical and hospital cases with Bay Area traffic that makes it more stressful to transport?
It does, doesn't it? Yeah, so I personally prefer to refer everything to the University of California at Davis. There are a couple reasons for that. Number one, I find that they are very thorough and they don't cut corners. Number two, they do a really nice job of keeping in touch with us as referring veterinarians, because what is awkward is when I send a horse for colic surgery and then nobody tells me what happens. And then I call the owner and they're like, oh, well, it was actually really bad and he's still in the hospital or something terrible. So I prefer to send to Davis because they do a really nice job and they're really nice communicators. And then also, I remember being a vet student, and if people don't send their horses to the vet schools, vet students don't get to see cases. So I think it's really important for the future of the profession to support the hospitals. So that is my opinion. I will also say in certain cases, the answer is whichever hospital you can get to in the most expeditious fashion is the one you should go to. But if I have my preference, I send to Davis.
100% agree.
Okay. Any other questions about colic really quickly before we move on?
Not that I
All right.
see at this moment.
Cool. Let's move on.
All right, next we are going to be talking about choke. So if you've seen this before, it can be pretty scary when you first see it. This is not choke that we commonly think of like humans choking and something goes down their trachea or gets stuck in the back of their throat. In the horse, choke actually refers to something getting stuck in their esophagus. So when Dr. Wright said how we pass an NG tube for colic from the nose all the way down into the stomach, that's usually 60, 66 inches before we get to the stomach. So that is a long, long tube that things can get stuck and just won't move all the way down. So Dr. Wright, may we go to the next slide, please? Okay, so signs of choke. Sometimes you will feed horses grain and then they will immediately start choking after that. And that's pretty obvious. You have a cause and now you're immediately seeing what's happening because of that. You'll see horses kind of do this like yawning, retching motion. They might start coughing. A lot of times they will start coughing and you will see food particles coming out of their mouth and their nose, and they just get really drooly. They start to extend their neck sometimes. And then sometimes you just see the horse that's like really quiet and not interested in food. I've seen some people think that the horse is colicking, but it turns out that they're just not as dramatic as some of the other horses that choke. But basically this is them showing us they have an extreme discomfort in their esophagus. They can't pass food all the way down, and they also can't cough it out themselves. Sometimes horses can have mild choke where they can resolve it themselves. You'll see it, they cough it, and then 10 minutes later, they're totally fine. They act like nothing happened. But in the most cases, we will end up having to see these horses. Causes of choke, it can be, usually we'll see it a lot. A big factor for choke sometimes is like a grain. So like beet pulp or something like that. If you don't give that super soaked and it absorbs a lot of water and then expands, if you don't give that really soaked and let it have time to soak, then that can very easily get stuck in their esophagus once it's mixed with saliva and going all the way down. Other causes can be Maybe they haven't had an oral or a dental exam in a long time, and that can also cause it. Maybe they're not chewing their hay enough, and then there are large hay particles that are getting stuck in their esophagus as well. So while we're waiting, what you should do, horses get really stressed out by this sometimes. So I really want you to keep them as calm as possible. Do not allow them any other food or water, because we don't want to have more stuck in their throat after that. So just keep them calm and quiet. If you can keep their head lowered, that is also important. Usually they're pretty stressed out, but whatever we can do to keep them calm and quiet until we get there. Sometimes they will relieve it and cough it out by the time we get there, which is fantastic. What will we do when we get there? These can be pretty messy. I actually really like chokes, but what we're going to do is get them really, really sedated. Like we'll do a quick little physical exam, make sure they're not running a fever, make sure their lungs are sounding okay. But honestly, we're going to sedate them pretty dang quickly. We want to do that so that their heads will lower to the ground, and we are decreasing the risk of potentially getting them to inhale some of that food particle saliva discharge into their lungs, because that can be another secondary complication of choke, is getting an infection and kind of a secondary pneumonia in their lungs. So we really want their faces basically touching the ground to encourage drainage out of their esophagus. We may also add some anti-anxiety meds. If the horse is really stressed out, that can really help. Or that same antispasmodic, that Buscopan, that can also help relax the esophagus. So we may use that in our sedation too. And then basically what we're doing is we are getting a large bore nasogastric tube, just like we would use in our colic workups. And we are trying to pass that down into the stomach. Usually we will hit the obstruction at some point. And what we're doing is we're literally just lavaging water in and out really gently to try to clear up that obstruction of food. It can take a long time. I spent 2 hours on one a few weeks back, ended up referring it to Davis, and they spent another 3 hours clearing it. So they can be quite significant, or they can be something that you can clear in 15, 20 minutes. It really depends on what the horse has had to eat and how much they've eaten since they initially got choked. So we will do that until we get to the stomach. Then we know that that is totally clear. Prevention for this, we talked about this a little bit, regular oral exams to make sure their teeth are able to chew up hay into the appropriate size particles before swallowing. We will ask, if we are doing grains where they inhale them really quickly, it's a good idea to soak those grains, and then not only soak them, but wait a few minutes before you give it to them so that it really has absorbed as much water as possible. And has, is not going to expand even more in their esophagus. Some follow-up care that we use for chokes, depending on how long it is. If they've been choked for a while, or it seems like it's a really, really tough obstruction, we will give them a medication usually called sucralfate, which is basically coating the lining of the esophagus to kind of, if it's raw and irritated, it's really going to soothe that area and allow food to pass a little bit more easily as the esophagus heals. The other thing I talked about that we mentioned was the secondary pneumonia. We will keep a close eye on these horses, especially if they've been choked for a while, to make sure that they're not getting any lung signs, more nasal discharge, more, whether they're starting to have an infection of their lungs. So we'll ask you to take their temperature, keep a close eye on them. We might put them on antibiotics, even if we're not concerned about pneumonia in this very moment, just to make sure that that doesn't happen in some of our patients. If horses have choked a lot, or, they're repeat chokers, because maybe, if they choke once and then they get a little bit of scar tissue built up in their esophagus, that area of the esophagus may be slightly narrowed and they are more predisposed to choke again. So sometimes we will actually scope these horses and put a camera down the esophagus to just look and see. And here is a picture of a horse getting scoped right now. And just to get a good look at that esophagus, how does the mucosa look? Is there scar tissue? Is it narrowed? Can we get all the way to the stomach? And sometimes we even have to use these cameras while they're choked to know what exactly is stuck in their esophagus and how far is it down in there. Here is our picture of our technician Sue, those are large apples, so hopefully he's chewing them up.
Do not be close to your horse.
Yeah, exactly. Let's see. I do have a question that I'm seeing right here. Depending on what a horse has ingested, is it like humans where they can't breathe and they could pass out or die? Good question, Robin. This is actually in their esophagus, so it's not blocking their trachea. It's in their esophagus. The more so the concern we get is them getting really stressed and anxious about it, and hopefully not getting, whatever is blocked in there or the grossness from their saliva into their trachea and then causing the secondary pneumonia.
Any other
And
questions?
let's see. Don't know if I have any other questions. Am I missing any? I hope not.
Okay, cool. They can always
Okay.
throw them in a little bit. Let's
Yep.
talk about eyeballs. Those are fun. So eye emergencies. These are something that are basically always an emergency. If you think something is wrong with your horse's eye, give us a call. And the reason for that is there's sort of a few different things that can happen. And there's a couple of those, they all kind of look relatively similar, but some of them can eventually end up with the horse losing their eyesight. That's not going to happen in like 2 seconds, but it's one of those things where if you treat it with the wrong medication or leave it for a couple days, it really can get bad really quickly. So when in doubt, call us out when it's an eye question. So the things to look for to decide if something is actually going on with your horse's eye. We've all seen the horse on the left with the eye swollen shut. It's puffy. Maybe there's some drainage coming out. They're rubbing it. They look miserable. Sometimes you see like this horse in the middle, like a big cloudy section on the actual cornea. Like those are all pretty obvious signs. One of the things that's more subtle, if you look at this horse, ignore the laceration, but if you look at the horse that's laying down in his shavings, and if you look at his left eye, so the one on the right side of the screen, and you look at his eyelashes, they are pointing down to the ground at a different angle than the ones on his other eye. So sometimes the only difference that an eye is having a little bit of a problem is just the angle of those eyelashes, and they're holding their eyelid just a tiny bit closed. So sometimes it can be pretty subtle. So I would just implore you to, if you think something's wrong, take a look, and then definitely call your vet, call us out, let us know, because there can be, just like I said, a couple of different things that we need to treat in different ways. If we look at this picture on the left side of the screen, you can see there's a kind of a green circle glowing. So this horse has a corneal ulcer. And the reason that we need to put this green stain in the eye is to determine if they do have an ulcer, because the medications we use for inflammation and the medications we use to treat ulcers are opposite, and they will make the other problem worse. So the other really important thing about eye meds is only use them for the horse that they're prescribed for the problem it's prescribed for. Because if you accidentally use the wrong one in a different problem, you can actually make the problem a lot worse. The other thing that we've got, oops, I'm going the wrong way. The other thing that can happen with eyes is they can get lacerations. I don't know if anybody has ever had a horse that's ripped his eyelid, kind of like this guy. And again, usually they do really well once we get it cleaned up and closed, if they haven't hurt the eyeball itself. And again, all of these are just things that need to get seen and need to get taken care of. If this is what you find when you come out to the barn one morning, take your saline. You can just use regular saline, like from CVS that you use like for contacts or for your own eyes. And you can use that to just try and squirt and flush any debris that you see, sawdust, anything like that, and get it out of there, and then give us a call. And we'll come out and we'll decide if the eyeball is okay. We'll close the eye, we'll do all those things. But yeah, the point about eyes is that if you have a question about it, it is always worth a phone call. And most of the time we are going to want to see it. Again, if you have old eye ointment sitting around, use it for the horse it's prescribed for the problem it's prescribed for. Don't put it in eyes without talking to a vet, just because, again, they can go kind of sideways. A lot of times with eye problems, we will put them on NSAIDs like buterbanamine just for some pain relief. For horses that have chronic eye issues, like the ones that are more allergy eyes where they're up kind of drainy and weepy, sometimes we like to keep them with a fly mask. And then prevention, obviously, for a horse that has ripped his face in the trailer or something like that, that's a little bit of a different story. But the message for eyes is keep it clean and call the vet. That's all. That's really what you need to know about eyeballs.
All right, acute lameness. So this one's obviously really scary. You could have your horse been totally fine yesterday, ridden totally fine, and then you show up to their stall today and they're standing on 3 legs, or maybe even trying to, or not even getting up. Really scary. So what do we typically look for with acute lameness? We want to know if there is swelling in the limb. Has there been any evidence of trauma? Do you see any wounds? Do you see, the stall door busted down because they punched through it, or anything like that? Digital pulses, another good thing to practice that we talked about a little bit. We want to know if those are bounding. Is there heat and a lot of blood flow in the foot itself? When to call the vet. If you see any signs of trauma, or they're really not putting any weight on it, we would rather see it. It could be a variety of things, but if there is also swelling in the limb, we want to know about it as well. There's a lot of important structures in the feet. If you see any wounds that go deeper than the skin and could potentially be in the area of a joint in the distal extremity, we want to know about it. And Dr. Wright's going to talk a little bit about lacerations as well. What to do while waiting for us. Again, I always say just keep them calm and comfortable. Keep them in their stall. You can always add another bag of shavings just so that they have some more support on their feet. And then ask us when we have a phone call with them. If you call and you say, I've taken their temp's in normal range, but they're 3-legged lame, there's no swelling, and should I give butyrbandamine? We'll have further suggestions about that, but we would love to know about it before you administer, because it's going to change our interpretation of how painful they are while we're there. And so the majority of the time, this is going to be something called a hoof abscess or bruising. 90% of the lameness occurs in the foot. So this is a common area, but of course, once we get there, we're going to do a full thorough exam and make sure that the rest of the limb does not hurt. Is it something that looks like it might be the foot, but it actually is something higher up, or vice versa? So we really want to palpate all the joints, all the limbs, range of motion, everything like that. What we do when we get out there is we are going to do a thorough physical exam, as we said, feel those digital pulses, look for any heat, swelling, wounds. And then this is a picture of Dr. Christy Moding, who's one of our Peninsula vets, using hoof testers, which is basically like these large oversized forceps that we are pinching on different aspects of the sole, the heel, the frog, to see if there are any areas of sensitivity. It is really helpful for us to see if the abscess is not draining yet, but if they have areas of sensitivity, that can kind of clue us into, oh, they might start draining here. And an abscess, for anyone that's lucky enough to not have dealt with one of these yet, is any kind of break in the solar surface where bacteria or anything can get in there. And then it kind of creates a walled off abscess of pus and gross, nasty discharge that then is super painful because it's walled off in the sole and then needs to start draining and getting out. Lots of causes of abscesses, but changes, the change in footing and, everything with the moisture of it's abscess season right now. So the ground is super soft. The hooves are getting soft. Things are, getting into the hoof and then getting walled off. And we're seeing a bunch of abscesses. They will either blow out through the sole down here, or we've seen a lot recently actually through the heel bulbs or the coronary bands. What we're going to do with that, for that last one that you saw, actually, if you look at the left side, that left picture, you can see where it is draining that darker portion. That looks like it's been pared out a little bit, maybe with the help of the farrier, or one of us has done it on the farm. You can also see that drainage in that right picture too. It's going to be gross, nasty, smelly, dark discharge. So what we're going to do about it is we're probably going to do some butyrbandamine to help the horse be a little bit more comfortable, add some support to their stall shavings, keep them dry and clean. And then what we're going to do is poultice those legs. What we really want to do is we have these really nice animal intex pads that have a poultice built into it. And we want to just draw out that moisture and the abscess itself and promote drainage on that. You'll be amazed at, a horse won't be standing on one of its legs and we put a poultice pad on here the next morning. They're sound at the walk, it's draining gross discharge, and they're so much more comfortable because that drainage has been established. We want to continue draining those abscesses and continue poulticing them, or soaking them is another thing that people do. until they stop draining completely. Because the last thing we want to do is only poultice for a few days. There's a little bit left in there. The hoof starts healing and forming and, closing off again. And then we have that abscess still walled up in there. So we want to make sure that we're poulticing until those poultice pads come out clean and there's no drainage anymore.
And I will throw in here, somebody did ask about wrapping. We have a YouTube video on how to wrap a hoof on our Starwood Equine YouTube channel. So definitely check that out as far as like how to actually wrap a hoof, because it is actually a little bit awkward until you kind of get a handle on it.
Yep, exactly. Yeah. And that video shows exactly the different layers of the poulticing support, that wrap and duct tape that we typically use. And we will sometimes offer radiographs too. If we want to rule out other causes of acute lameness, those are kind of our go-to diagnostics in the field. Laminitis, we'll just touch on this really briefly. This is inflammation of the sensitive tissues and structures of the foot. So Dr. Wright and I like to think of it as kind of, there's the Velcro between the hoof capsule itself and the coffin bone. And it really forms this Velcro with these lamina that, have a bunch of blood flow and are keeping that nice and tight in the hoof capsule on there. If there's any sort of inflammation, that can start to kind of break that connection. And that is incredibly painful for the horse. So typical signs of laminitis, you'll see these parked out cases where they're really trying to get off of their front feet. It's usually front feet because those weigh more. It can be 1 foot or it can be 2 feet, depending on the cause. If a horse has something else going on in their leg and they're putting a lot of pressure on that contralateral limb, that limb is more predisposed to developing laminitis because it is bearing all the weight all the time. Other causes of laminitis, grain overload or any sort of toxins to kind of, those are common as well. But the most common that we see, metabolic syndrome, obesity, Cushing's. So overall endocrine conditions that are leading to increased levels of circulating hormones, whether it be insulin or cortisol, leading to laminitis in hooves. Road founder is another one. Typically see it in working horses that are running on roads or hard cross country. That's another one that you can see where they're really sore. We love to take radiographs on these cases, as I mentioned previously. We're looking for how that coffin bone is sitting in that hoof capsule. It is important to note that there is a bit of a radiographic lag between clinical signs. A horse can be really, really uncomfortable and showing signs of laminitis, but those x-rays don't look like they've changed yet. Sometimes you really need a bit of time for those x-rays to really show any changes, but of course the horse is really uncomfortable. It's really important for us to use these x-rays as monitoring, because even if, they look great now, we may repeat those x-rays in a few days to see how they've changed.
And your farrier is going to be a really important component of the team when dealing with either a hoof abscess or a laminitic horse. Mm-hmm. So definitely make sure that we're all connected, farriers, vets, owners, everybody, because it's a team effort when we've got horses with foot problems to get them back to where they need to be.
Yep. Exactly. And they can make very subtle changes in shoeing and how the conformation and the balance is in the foot. That's going to make those horses less predisposed to abscesses, and also just help with their laminitis completely, just how they're trimmed and how they put the shoes on. Let's see, we might have some questions here really quickly. Someone asked, is there an advantage to soaking or when you poultice versus soaking, or do both? It is kind of personal preference. I personally love the Animal Intex pads because the poultice is in the pad itself, and then that pad is going to be wrapped up in that hoof bandage, and they are being poulticed 24/7.
Yeah, I like to say that if you are efficient or lazy, the poultice pads are the way to go, because you just have to deal with them once a day or once every other day, as opposed to standing with your horse's foot in a bucket.
Yeah, exactly.
But that, again, personal preference.
Yep. It's always hard to keep them in a bucket too for more than 15-20 minutes. Maybe beyond the emergency scope, but if time, could you talk about white line disease?
We can touch on that really quickly, because that's another one that is that goes with the farrier veterinarian conversation. And it usually happens because of imbalance in the foot. So sometimes taking radiographs, if you've got a horse that's getting some white lines, so separation from the sole and the wall, and getting maybe a little bit of infection or some chronic abscesses, radiographs with the farrier on site are always really helpful, because sometimes a simple change to the balance of the foot will help it grow more appropriately and then stop with the white line situation. Because usually, so the thing with white line is it's almost a chicken or egg, except not really. Like it's a hoof balance thing that leads to infection in the foot most of the time. So getting the farrier on board and doing some x-rays can be really helpful to prevent it from getting worse and to help it in the future.
Thanks. And then the last one is, what is road founder? Very, just it'll present kind of like laminitis. They want to get off of their front feet. Their feet are really sore. They've been either running on a really hard cross country course or, working horses that are running on asphalt themselves. They'll present kind of like laminitis. They may not show the radiographic signs of it, but they are really, really tender footed and sore in the front. I think those are all my questions.
Okay, let's get to the good stuff, the lacerations. Hopefully, I don't think I have too many gross pictures in here, so if you're squeamish, take a quick peek and then close your eyes. I think this is all maybe just pictures. But basically, lacerations are something that can happen anywhere on the horse. There are areas that are more dramatic, and then there's areas that are pretty easy to fix and not that exciting. All of them need to be at least a photo and a phone call so we can determine where on the spectrum of intervention we need to go as far as a laceration. But the things, I mean, you guys know, you have horses. It doesn't matter what you do, like eventually one of them will hurt themselves. That's just what they like to do. So when do we want to hear from you? Anything that's deeper than the skin. So if it's just kind of an abrasion with some hair loss and maybe like a scrape, I don't necessarily need to hear about it. But if you think it's through the skin and you can see any of the muscle or the white and clear fascia underneath, then you should definitely give us a call. There's a lot of things that will heal just fine without intervention, but we can make them heal faster by clipping it, cleaning it, closing it, and moving on. So, it's always worth a phone call. Definitely. And I have a picture of this, but if there's ever a question about a wound over a joint, the veterinarian needs to see it. The reason for this is that if an infection gets into a synovial structure, so a joint or the tendon sheath, so where their tendons are in the back of their leg, those structures, if they get an infection in them, they can actually be life-threatening because they are very, very hard to clear out. So if there's ever a question about how deep a wound is, and if it's anywhere near one of these joints in the distal limb or on the back of any of their cannon bones where the tendons are, absolutely needs to get a phone call and a visit. And then, so let's say you come out, you find your horse, they've cut open, let's say their chest or something. What are you going to do while you wait for me to come out there? The first thing I'm going to ask you is your horse up to date on tetanus? So that's something that you should know. If you're our client, we obviously will have that in our computer, but it's still good information, especially if you're out traveling and you're somewhere where you're seeing a vet that's not your regular vet. While you're waiting, if the horse is actively bleeding, especially on a distal limb, try and stop it. So if you have a clean towel, a diaper, anything like that, try and cover it up and just put some pressure on it. You can use a pillow wrap and just do a standing bandage, but just something if it's actively bleeding to try and put some pressure on it. If you have a hose, feel free to hose it. Hosing and flushing is one of the best ways to get debris and bacteria out of a wound. If there is a foreign object stuck in your horse, whether it is a nail in their hoof or a big piece of mulch in their chest or something like that, try and leave it until the vet gets there, because number one, if it's in the foot, we really need to know exactly where it is, and we're going to need to x-ray and do a bunch of stuff. But then also, if it's anywhere else, we just want to know, right? Like, if a lot of times there will be something and you'll take it out and then you can't even see the wound anymore because you removed the mulch or whatever, the stick that was in it. And then we have a hard time trying to figure out exactly what's going on. So unless it's something that is actively making something worse and the horse is freaking out, just leave it and we will deal with it when we get there. So again, while you're waiting, if it's actively bleeding, try and stop the bleeding just like you would with a person. Some pressure with something clean over top of it. Flush it out if you can, and do not pull anything out. And for the hoof, I cannot say this enough. If there's a nail in your horse's foot, do not pull it out. Please, 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 please leave it until we can x-ray it. Somebody asked in the pre-questions what to do if you're out on the trail and the horse gets a cut or a laceration. And I'm assuming you probably mean on the distal limb. But either way, I would always throw some nonstick wound pads and a vet wrap in your saddlebags, in your backpack, in whatever. Your goal is to cover it so it doesn't get full of dirt, and then get away, come home, get on your trailer. You can stop at, wherever you are at Davis or Pioneer. If you're on your way home, call your vet, whatever you need to do. But I would just try and cover it to keep it from getting more contaminated and get home. If you do have clean water, like in a water bottle or something like that, feel free to go ahead and rinse it and then cover it. But that would be my advice. And then of course, like, please don't ever go anywhere by yourself, because that's when bad things happen. So again, this is our key synovial joints. And I will also say, of course, if there's any cut near the eye, that counts as something that you need to call and have your veterinarian take a look at. This is just a picture of this horse who, I don't know exactly what he did, but I think Dr. Zaytunian's closed this one up. And we just thought it was really cute because it ended up looking, where did it go? Just like a happy little M. It closed up really nicely. I will say wounds on the face look very dramatic and they bleed a ton, but most of the time wounds on the face heal really well. And the horse won't usually have a lot of scarring or anything like that. Again, the ones that we get really concerned about are the ones on the lower legs. If they're deep and near something important, they can cause trouble. And then depending on how big they are, sometimes they can get, if we have to close a big flap, they can be kind of hard to keep closed and keep the horse quiet enough to let it heal. Does anybody have any questions about lacerations that I didn't address?
I do not see any in the chat so far.
Okay, cool.
Give it a few seconds for people to type.
Yeah, we'll just go, I'll throw up this little, somebody asked about trailer accidents. So my advice for that, and this goes, even if you're going to a show in Petaluma or wherever that's not that far, you should always have phone numbers of equine hospitals and veterinarians along your way. I know on the East Coast, there's a whole list going all the way up 95 of like all the exits and what hospitals are there. I don't know if there's one available on the West Coast, but we all have phones, so probably you could find it. But I would have that information with you before you go so that you know who to call or where to go if you need it. For a trailer accident, obviously 911, highway patrol, whatever you need, and then call a vet on your list. This is another situation where people need to stay safe. Horses, like, obviously we all love them and they are super important, but please don't put yourself in harm's way after something happens out there, and wait for the professionals to come sort it out. Dr. McCarthy is going to talk a little bit about some of the emergency rescue situations that are available around here.
Yeah, so when I was at UC Davis, I worked with the veterinary emergency response team up there, and there was actually someone that came over from the UK that has actually been training with all the firefighters in the Bay Area. So a lot of different firefighters that we worked with, both in East Bay and up near Davis too. We would do kind of run through scenarios with them for downed horses and trailers and work together to extract these horses, but also just give these firefighters a kind of knowledge, a little bit of an education about like what you should and shouldn't be doing about horses in distress. And also just kind of, you know, the awareness of how huge these animals are. And there's nothing that, you know, one of us who's, you know, in the 150 pound range is going to do to stop an animal that's in distress. So really working with them. So a lot of firefighters coming on scene, like they have some knowledge and some experience with working with veterinarians and rescue workers to work with horses in trailer accidents. It's been great to see how many people have been trained in that.
Does anybody have any questions about any of that before we talk about rattlesnake bites, which were another question that we got ahead of time?
Not that I can see so far, but you guys can keep typing that if you have any.
All right, Bridget, this is you.
Rattlesnake bites, as much as I hate snakes, but rattlesnake bites are not uncommon in this area. We share the same spaces they do. If it's cold, they'll come into stalls, they'll be out on trails, they're everywhere. Another thing that you should have in your first aid kit is like a large, either a piece of a hose or a large syringe case that you kind of cut off so that it is a little bit of a tube. The reason for that is rattlesnakes typically will bite horses on the nose. Can sometimes happen on their distal legs too, but usually it's when their horses are, you know, a little bit interested and they're curious and they ended up getting bit right on the muzzle. I saw a few of them while I was up at Davis. Since horses can only breathe through their nose and not through their mouth, this is really, really important that if they're going to start swelling up after that bite, that we maintain their airway. That is the absolute most important thing. So keep a little bit of a hose, keep some KY jelly, you know, some sort of lubricant that you are able to, if you start to see that horse swell and have difficulty breathing, you're going to shove that tube literally into their nose and keep that airway open. If you're out on a trail, keep them as calm as possible. If there's a way to get the trailer closer to you, do that. Call us immediately. We might recommend, you know, putting some butanbanamine to kind of further decrease that inflammation, but you're going to go straight to a clinic. One of the good things is Starwood Equine and some of the other big practices in the area. There is an anti-venom for rattlesnakes that we actually have access to. So, you know, it's not going to change the fact that we want them there in a hospital to provide fluids to further kind of diurese the toxin out. But that is another thing that we have access to that can kind of help and delay the time needed. There is a vaccine for rattlesnakes. It doesn't have a ton of efficacy. I was thinking about it for my dog too. It's not going to change the course of action. It just might buy you a little bit more time. Don't do one of the 15 tricks that people tell you about of trying to cut open the venom or suck out the venom or whatever everyone says. There's so many theories. Don't do that. Just keep the horse calm, get them to a hospital and make sure that they have their airway. I think that's all I got on that one.
So that kind of is a super fast going through all the things. We have some time for questions if anyone has questions of anything that we talked about.
Thank you, Karen, for putting in the local resources for the EVAC group.
Girls, do you guys have any questions?
How long, Connie says, how long should the hose be preserving the airway for on a bite? It's until they can breathe on their own and we get them to a hospital so that the swelling can.
The size of the hose, I bet.
Oh, how long should that? That's a good point. I've seen a few 8-10 inches long. I've seen big syringe cases work too. It really is just kind of making sure that it doesn't swell closed.
Yeah, I mean, I think if you have it, a foot would be a lot because it might come out. So I think the 8 to 10 inches would be a good, that would probably get to the pharynx without too much trouble.
Yeah. Little tip or trick, keep some tape on you so that you can put tape on the very tip of it and kind of tape it to their halter or something like that so that it doesn't fall out or get sucked up a little bit too far if it's not long enough.
Stop sharing my screen. That was awkward. Cool. Vicky, Amanda, do y'all have anything else to add? Because if people don't have any questions,
Oh, we did have a question, Dr. Wright, on whether we can share this PDF of this presentation or not. I did not know the answer on top of my head, so I thought I'd ask you.
oh, yeah, I'm sure we can, but I also think we probably have something that is put together a little bit more easy to read with this information. So I will come back to you with that information and we will get you something.
Great.
Wow, the emergency line is ringing.
Wow, how fitting.
I'm going to answer the phone. Thank you all for coming.
Thank you so much. It was great. Thank you for all your help and the work on this. And we will, hopefully that isn't a bad emergency and you guys don't have to run right out, but really appreciate your time and trouble. And I think it was a great refresher course for a lot of us, as well as just understanding, you know, what to do and what not to do. I think, you know, because we all panic, oh, I don't have betadine on hand. I'm, you know, was I supposed to scrub that? And, you know, all those things. So it just the common sense of hosing, flushing, cleaning, you know, keep it simple. All of that is really, really important. So, and one question I do have is if there is a trailer accident and a horse goes down inside the trailer, what do you do? I mean, do you just wait for the firefighters?
Yeah, and it's tough too, because it's, you know, is the horse going to be smart about it and just kind of lay there? Or are they going to be struggling and trying to get up? And usually it's the latter because they're prey animals. If you know, if they're able to get up on themselves, let them do it. If they are in a place where they are really stuck and they're going to need to be extracted. We've gone through multiple scenarios with the firefighters, but like the vet is going to be critical in that, in usually putting them under general anesthesia, to be completely honest. Okay. We'll do a little bit of injectable anesthesia. We have ways to extract the horses really quickly, and then they're in an open area where they can recover and get up after that. Obviously, that's like very worst case scenario, and that doesn't happen frequently, but it is good to have a vet on site that can, you know, and there might be wounds too, and address all of it at once and make sure that the horse is staying stable, most importantly.
Right. Okay. Well, thank you so much. Really, really appreciate it. Thank you everybody for joining. It was great to have this response from everyone, and we hope that we will do more of this. And as they mentioned, Starwood has a lot of YouTube videos as well as documentation for different kinds of situations on their website. So great resources to be had. And again, thank you very much, everyone.
Oh, we have one final question from Miss Lucy. On the first aid kits, what kind of ointment should you have? A triple antibiotic ointment is fantastic. You can just pick those up at CVS. Another one that we really recommend, and it works on nearly everything, is SSD ointment. So silver sulfadiazine ointment. It's a fantastic one that has good antimicrobial properties, is soothing. It's great. So we recommend that one as well.
Where do you get that one?
You can get it from us. Sometimes you can find it. I think you can find it in some feed stores as well. The big tubs of it are, I think they're blue colored with a black top, it might be, but silver sulfadiazine.
Silver sulfadiazine. Okay.
And we can include that on our list for that first aid kit. I'll make a note of that right now.
Thank you.
Yeah, of course.
Okay.
Yep. All right. Well, thank you very much for your time, everyone. It was lovely to see many of you that I already know and meet some others.
Great. Thank you. Good night, everybody. Have a great rest of your weekend.
Bye, everyone.
Bye.